times I always tell people beware of Dr. Google.
Yes.
A lot of things that are on Google may not necessarily be specific to your situation. So I always tell people, ask us, because we know your history and we can actually apply that information to your specific situation.
All right. So while we're waiting for people to weigh in with their questions, I know that we've got, thank you, Keith. I really appreciate it. Hey, thanks you guys for checking in. I really, I love to see these questions. Let's start off because we have some great viewers and you guys are always so open with us, so we appreciate it. Kaylee Monroe Adams, thank you. She's talking about what causes the hair loss in the first trimester.
So a lot of that is hormonally related. So there's a lot of changes in the hormones in the first months of pregnancy, actually throughout the pregnancy. You get an increase in your progesterone and your estrogen, and so that causes a lot of changes. You can get hair loss in the first trimester, and some people will even see hair growth later on in the third trimester and even postpartum. So those are some changes that are unique to pregnancy.
Yeah, I know a lot of women who said their hair got really nice and thick and full,
And
and
then
it all fell out. Yeah,
that's the withdrawal of the hormones after the delivery.
Okay, that is the cycle. Hey, Misty is saying, talk about CMV. It is important. What is CMV?
CMV is Cytomegalovirus. That is a virus that actually a lot of people get exposure to prior to pregnancy, and we actually like that people get exposed to that prior to pregnancy. The problem is when people get first exposed to it during a pregnancy. That can actually cause a serious infection to the baby. And so we don't do routine screening for CMV only because we don't have an effective way to treat a mother and a baby once you have it for the first time in the pregnancy. So we recommend just very good hand hygiene. The virus is usually caused by not washing your hands, especially if you're dealing with young children. So good hand hygiene. If you're pregnant and you have young children, not eating after children, that's another way that gets passed along. And so that's just to prevent you from getting that first infection in the pregnancy.
Got it. Okay. Hey, thank you so much for that question. How late can I have a baby? I want to have my third baby. I'm about to be 34 years old. So we're talking about maternal age.
Maternal age. So 34 is actually still considered below advanced maternal age. Advanced maternal age is typically defined as 35 years or older, but we're seeing a lot of women coming, especially with first babies after 35, because people are having their careers, starting their careers first before having children. So 34 is still considered actually not advanced maternal age. And even so, we're seeing more of the risk are actually after age 40. And so talk to your doctor about your health conditions. Do you have any health conditions? Those also weigh in as to how your pregnancy is going to go. But usually if you're pretty healthy, that should be fine. Okay,
Elizabeth, you can have that third baby. Okay, Tokara is saying, why don't doctors know about post-tubal ligation syndrome effects after having a tubal ligation? I don't quite... I was diagnosed premenopausal after it was done. What does that mean? Can you walk us through that?
Yeah, so usually with tubal ligations, they shouldn't affect your hormones. Most of the hormones are usually with the ovaries, and we typically don't disrupt the ovaries when we do a tubal ligation. We're just simply disrupting the continuity of the tubes. Some people, usually what most people will report may be differences in their menstrual cycle, and it's actually not necessarily due to the tubes. Sometimes a lot of patients, when they are on contraception, were on hormonal contraception, which was controlling their periods, and now that you have a tubal, you get off of those things. People can see differences in their menstrual cycles, maybe have heavier cycles because they're no longer controlled with hormones that they were before. But typically, your hormonal levels should be normal after a tubal. And so definitely if you have issues like that, definitely talk to your doctor about any kind of contributing factors that could cause those issues.
All right. Back to talking about being pregnant and the delivery process, which is something we addressed in our Wear the Gown series at 4:30. Lola is asking, how risky is it to have a C-section if my last C-section was a year ago?
That's a really good question. So we recommend that you have about 18 months between with trying to conceive after having a C-section. The reason that we like that is because it allows the uterus to heal from the C-section. When you have closely spaced pregnancies, especially after having a C-section, there is an increased risk of that scar opening up, a uterine rupture. And so we like to make sure that the uterus is well healed before going with another pregnancy. But even outside of having a C-section, even if you've had a vaginal delivery, we still like to have good pregnancy spacing, waiting at least 18 months before conception, again, because pregnancy, you use a lot it takes up a lot from the body.
Yeah.
It depletes a lot of the nutrients. It gives the body time to really restore itself after having a pregnancy.
So 18 months is kind of the magic number as far as getting your body back to where balanced. In
Exactly.
That sense. Okay.
Getting back to baseline before starting another pregnancy.
And we were talking about VBACs, and a lot of women saying they would, after having a C-section, they wanted to try a vaginal birth. Maybe tell us a little bit about VBACs and how common they are, and who's a good candidate for one.
Good, that's a really good question. So good candidates for having a trial of labor after cesarean are patients who had a C-section. So the type of C-section makes a difference. We want the horizontal cut, and we're not just talking about the skin, we're talking about on the uterus, and that's something you need to talk to your doctor about, because what kind of skin incision you have may not dictate what kind of uterine incision you have. And then secondly, we want it to be for a non-labor reason. So common non-labor reasons why people have C-sections, maybe the baby was breech or head up, maybe something along those lines. Or during the labor process, the baby was in distress and we had to do a C-section. People who may not be as successful are people who were in labor and they stopped dilating at a certain time. So say you got to 6-7 centimeters and you stalled out, or say you got to completely dilated and were unable to push out the baby. That has a higher risk of happening again in the next pregnancy, and so you would have a higher risk again of having a C-section. So 1, what is the reason why you had a C-section? 2, what type of C-section you had? And 3, how many C-sections you've had. We typically recommend really 1 to 2, and really not more than that, because that increases the risk of, again, uterine rupture, that scar opening. So these are all good things to discuss with your doctor, to kind of talk through the details of your previous C-section, and then come up with a plan to see if a TOLAC is the right thing for you.
All right, good to know. Thank you so much. Hey guys, keep these questions coming for Dr. Ankumah. She is answering them, and a lot of you have some really great questions. We really appreciate it. Let me see here. Is bleeding normal during the first trimester? This is a question a lot of people have, especially first-time pregnancy, because we think you're not supposed to see any blood, and that's a bad sign. Tell us about that.
Definitely, you should let your doctor know if you have bleeding. Bleeding is something important that we do track in the first trimester. While there are a lot of normal pregnancies that may have some spotting during the first trimester, which resolves completely, it can be a risk factor for having a miscarriage. So we want as doctors to know if you're having bleeding, so we can monitor you for that. And then also, it's very important because we want to know what blood type you have. Patients who are Rh negative and have bleeding may need an injection called Rhogam to help them to prevent from having antibodies that attack the baby's blood cells. So definitely, if you have any bleeding at all, please let your doctor know. It's something that we want to know about and track. But that being said, we also see a lot of pregnancies in the first trimester that may have some spotting that still go on to have successful pregnancies.
But you're saying even if you're just having spotting,
let your doctor know.
It's still take it seriously.
Okay. Absolutely.
Thank you so much. We really appreciate that question. Heidi, I really appreciate you asking that. All right, let's see. Okay, this is from Debbie. My daughter-in-law has uterine fibroids and a lot of pain. 4 months pregnant. What can she do for the pain? How do you manage pain when you're pregnant? That's
a really good question. So a lot of our pain modalities are limited during pregnancy. We don't recommend the use of ibuprofen, naproxen, or NSAIDs, because those medications can close a small duct in the baby's heart prematurely, and it can also lower the amniotic fluid. So really, we're limited in the amount of things that we can use at home. Typically, we start with Tylenol. You can use Tylenol at home. Specifically, though, for ladies with fibroids, especially if they grow during the pregnancy, they can have what's called degeneration, which means that the fibroid grows so large it outgrows its blood supply, and the inside liquefies, which causes really bad pain. So we tell our ladies that have fibroids, if you're having severe abdominal pain, let your doctor know. We can, in the hospital, give you some medications that are similar to ibuprofen for short periods of time under supervision with the doctor to help with that pain. So those are options for, especially with our ladies that have fibroids. But at home, we do not recommend the use of ibuprofen, naproxen, any of those. Typically, Tylenol is our go-to in pregnancy.
All right. Debbie, thank you for that question. I hope your daughter-in-law gets some help with that. That is important to look into. Okay, how often should I have an OBGYN exam? I don't know if this is necessarily pregnancy related, but hey, how often should we be coming to your office?
So just in general, for well women exam, we recommend yearly.
Okay.
And I really emphasize this because our pap smear guidelines have changed, where that if you have a normal pap smear, you may not need a pap smear every year. That being said, it does not mean you don't need an exam every year. We still want to do breast exam. We still want to listen to your heart and lungs. We still want to do a pelvic exam and make sure that everything looks fine. So we recommend yearly exams, and then based on what your pap smear is, that'll dictate how many years it is until you get your pap smear, but come to see us every year.
Can you get a yearly pap smear if that's what you decide to do?
So we usually recommend not to do that unless there's a medical indication.
Okay.
Really, that increases our risk of having false positives, and it increases anxiety and stress. So really, if you meet criteria to not have yearly, you don't need yearly.
Okay.
If for some reason the doctor sees something that's of concern and you need to come back sooner, then by all means do that. But we basically just go by what your pap smear is. If it's normal, we space those out. If they're abnormal, close follow-up.
Good to know. Thank you so much. Okay. This is interesting. If mom has twins, do their kids end up having twins? I mean, everyone says twins run in the family. Is that true?
Twins can. They're definitely, when we look worldwide, there are even certain ethnic groups that have more twins than others.
Oh,
so there may be some genetic disposition to twins. Absolutely.
Interesting. Very interesting. Okay. Where is your practice? Elizabeth asking, where do you practice?
Perfect. I practice with UT physicians, and my particular practice is in Bel Air off the West Loop.
Bel Air off the West Loop. All right. Now you know. Thank you, Elizabeth. Let's see here. Okay. Oh, this is interesting. So Veronica's asking, how long after being on birth control for more than 10 years should I wait to try? Does my body need to essentially get rid of the effects of birth control? How long does it take to leave your system?
That's a good question. There's no rule that you have to wait a certain amount after being on birth control to conceive. A lot of the hormones that we use in birth control are actually hormones that your body makes. We just use them in higher concentrations. So really, after discontinuation of birth control, you can try to conceive right away.
All right, great question. Thank you, Veronica. Let's see. Can I still have a baby if I had a LEEP procedure? What is a LEEP procedure?
A LEEP procedure is a loop endocervical procedure where we remove part of the cervix, and that's usually for patients that have abnormal cervical cells. So this is somebody who may have had a pap smear that was abnormal, went on to have a biopsy where there were abnormal cells, and so they removed that portion of the cervix to eliminate those abnormal cells. You can still have a baby after a LEEP. We just watch closely to make sure that there's no signs of preterm labor, but patients with LEEP successfully have babies.
All right, that's good to know. Thank you, Elizabeth, for that question. Okay, this is interesting because this is getting a lot of people are talking about endometriosis and having to deal with that. We've seen a lot of celebrities come out in the last couple of years saying they deal with it, and that it's a very painful condition for so many. A lovely Mimi Perez asking, I was diagnosed with endometriosis. I'm trying to have another baby, but I'm kind of holding back from getting pregnant. I mean, what does she need to know if she wants to have another child?
Yeah, ladies with endometriosis can certainly have children. Some of them may conceive naturally or by themselves. Some of them may require help with IVF, so it just kind of depends. I've seen it different ways where people conceive spontaneously and people don't. Some people, their pain improves improves during the pregnancy. Some people still have issues with pain during the pregnancy. And it's definitely important to let your doctor know, especially if you've had severe endometriosis, if you've had any surgeries regarding the endometriosis, have you had any scar tissue. That's important for us to know, especially if we end up needing to do a C-section, so we kind of know what to expect when we go in there. But definitely we have patients with endometriosis that have successful pregnancies.
Okay. Can you explain to our audience a little bit about endometriosis if people aren't aware of exactly what the condition is?
Right, so endometriosis is a gynecologic condition in which we think that there may be some backward flow of menstrual blood during the cycle, and this can lead to little implants of endometrial tissue outside of the uterus, which can cause extreme pain. And so these patients can have cyclical pain that's pretty severe, and it can be debilitating at times, especially if it's severe.
Cassidy Cox has a question that I know a lot of my girlfriends have talked about. Not everyone's menstrual cycle is regular, and so you wonder, is that going to make it more difficult for me to get pregnant? Is that an indication of fertility?
So it certainly can be. Definitely for patients that have irregular cycles, it can be a little bit more difficult to get pregnant. That being said, not everybody has difficulties with fertility, but some can. Definitely we can even see that sometimes with polycystic ovarian syndrome or PCOS. These patients tend to have irregular cycles where they could even go months without having a period, and they may need the assistance with maybe medications or maybe seeing an IVF specialist in order to get pregnant. So definitely something to talk about with your OBGYN and see, one, if there's anything to regulate your cycles prior to becoming pregnant, and two, even after that, if you're still having difficulties, maybe needing the help of a fertility specialist.
Good to know. Thank you so much. And hey, Cassidy, thank you for asking that question. A lot of our viewers are liking that question, saying, ask this one. So I'm glad that you were able to answer that. What is the cutoff age for having a tubal reversal and getting pregnant? That's from Lisa.
So the way I talk about tubal reversal is not really a cutoff age.
Okay.
It is the fact that not all tubal ligations can be reversed. It really depends on the amount of the tube that is removed. And so I always tell patients that are having a tubal ligation, make sure you're 100% sure you don't want any more kids, because there's a possibility that when they go back, they're not able to reverse it. The other thing is, even if they're able to reverse it, now where they separated the tube has a little scar there. And so now there's a risk that that pregnancy, when it comes together and it travels down the tube, can get stuck at that area where they put the tubes back together, which could lead to an ectopic pregnancy. So certainly patients have successful pregnancies after tubal reversal, but I always tell people not all tubal ligations can be reversed, and then also they can slightly increase the risk of having an ectopic pregnancy, but there's not an age cutoff.
Okay, thank you very much for that clarification. Let's see here. I've got, you talked a little bit about PCOS and how to get pregnant. Is there any more you can to elaborate on that, or you pretty much covered?
Yeah, most of
the
it
issues
is
with
just medications that can be used, and then in the case that medications aren't used, sometimes people would have to go to IVF for pregnancy.
Okay. Jessa is asking, what are the chances of preeclampsia coming back? I had it with my first two. I'm pregnant again. I'm worried about having it again.
That's a really good question. So preeclampsia, for our viewers, is a condition in pregnancy where you can have high blood pressure and protein in the urine, or symptoms such as headaches, changes in the vision, pain on the right upper side where the liver is. And so we really care about this condition because it can, if it's not monitored well, can cause damage to the brain, can lead to seizures, can cause damage to the liver, to the kidneys, those kind of things. In terms of risk factors, so if you have a history of preeclampsia, it depends on some of the details of the preeclampsia, how early it occurred, but you can have up to a 20-25% chance of having that recur again in a next pregnancy. And the more times that you have it in a pregnancy, that risk is increased. So that's definitely something that if you have preeclampsia, please let your doctor know, especially if you have preeclampsia prior to 34 weeks of gestation. We highly recommend taking a baby aspirin, 81 milligrams daily, may help to prevent your risk of having preeclampsia in a future pregnancy.
Is it common to get preeclampsia before 34 weeks?
It is not as common as after 34 weeks.
Okay.
So it's more common to get preeclampsia after 34 weeks, or even when you're full term after 37 weeks.
Wow. Okay. All right. Thank you so much for that question. This is a really good one, and Maria, thank you so much for asking about this, because this is a sensitive matter for so many people. She's asking, how long should you really wait to get pregnant after you have a miscarriage?
That's a really good question. I always say talk to your doctor first before trying to conceive after a miscarriage, because a lot of it will depend on the details of your specific miscarriage, what went on during that process. Did you pass the pregnancy spontaneously, or did you have to have a D&C? But I would say on average for an uncomplicated miscarriage, most doctors would say wait around about 3 months or so before trying to conceive. But definitely before trying to conceive, talk to your doctor about your specific situation, and so that you can get more tailored advice.
All right, that's great. And hey, thank you guys so much for asking these great questions.
You know, these are fantastic
These are great questions. Sometimes they're sensitive, it's hard, but you know, this is a safe space, and we love these questions that you guys are asking. Okay, is off and on cramping during the first trimester normal?
So a lot of patients do have cramping during the first trimester. And again, to me, it kind of goes along with the bleeding. that's something that we as physicians want to know about, because it can maybe increase the risk of having a miscarriage, but then again, there are lots of normal pregnancies that have cramping. So that's just something that if you are experiencing pretty significant cramping, let your doctor know so they can examine you, make sure that everything is still looking good with the pregnancy and that you're not having a miscarriage.
There's cramping, and then I remember from personal experience, I would feel like these bands were being pulled, and that's the stretching. So maybe differentiate the two feelings, I guess, for people.
Yeah, so the cramping sometimes can actually feel like menstrual cramps.
Yeah.
And we would like to know about those, definitely, just to see how you're doing, make sure that everything is going well with the pregnancy. Definitely, as you go on with the pregnancy, you can get this tightening and relaxing, which may not feel painful, but you definitely notice that. Those are Braxton Hicks contractions, and we do expect to have those, but we also want to know if you're having them frequently.
Oh, yeah.
Especially like more than 6 times in an hour is a lot. And then sometimes people can also have groin pain. That can be what's called round ligament pain. That is the stretching of the ligaments as the pregnancy grows, which can be quite uncomfortable. Sometimes maternity belts can help to alleviate that discomfort.
Absolutely. Brittany is asking, is depression normal during pregnancy?
That's a really, really good question. Depression can be normal during pregnancy, and actually is pretty common during the postpartum period as well. About 80% of women have some form of postpartum blues, where they may feel tearful for no reason, or feel down, or sometimes may not feel like they want to be with their baby. Definitely, it's good to have good support systems around you to encourage and support you, and definitely let your physician know. A lot of these things can be normal and can pass with time, but we want to know for warning signs that it's progressing to something else that may be a little bit more serious, that may need the help of medications or may need the help of counseling. So we have all those options available, but a lot of times we may not know about it unless you bring it up at your doctor's office. So we're definitely wanting to hear about those feelings that you have, any signs of depression that you have, so we can tackle it head on and make sure it doesn't become a major problem.
Yeah, and Brittany, thank you for asking that question, because it really kind of drives home the point that you need to be honest and open with your doctor, no matter how you feel, or if you're embarrassed to talk about it, don't be. I mean, a medical professional is the perfect person to talk to. Okay, let's do a few more questions. Oh, this is interesting. Kimberly wants to know, and we see this a lot because we've seen like Halle Berry, and we've seen a bunch of people get pregnant at later stages, but can a woman get pregnant at age 47? So we're talking advanced maternal age.
Yeah, this is very advanced maternal age. Can a woman get pregnant at 47? Definitely. That is definitely possible, and we have been seeing that a lot. We've seen that with a lot of celebrities. So there's different ways that can happen. Usually this is happening through IVF, and usually sometimes they're using donor eggs, because I will say a woman is born with all the eggs that they will ever have. So at 47, your eggs are 47, the eggs that are left. And that does increase the risk of having a baby that may have a chromosomal or genetic abnormality.
Yes.
So definitely one thing to talk to your doctor about if that is something that you're trying to pursue, having a baby later on in life, and we can talk to you about different options that are available.
All right. Let's see. Pamela is saying, I had HELLP syndrome, HELLP syndrome, when pregnant with my twins. What are the risk factors for my daughter who is now pregnant? So explain what HELLP is first, and then risk factors.
So HELLP is an acronym that stands for hemolysis, or breaking down of red blood cells, elevated liver enzymes, and low platelets. This is actually part of the spectrum of preeclampsia. So this is a severe form of preeclampsia. These patients also have high blood pressures, but they end up having these laboratory abnormalities. So definitely it's a serious condition that warrants immediate delivery whenever we detect this. It's not necessarily hereditary, so just because a mom has it doesn't mean that the daughter will have it. Definitely something that we like to know about, so we will watch the blood pressures more carefully, but it does not mean that it would occur in that pregnancy.
So it's important for her doctor to convey that to her doctor.
Right.
Okay,
just
that's good
say,
to know.
Hey, this happened to my mother. We would just watch the blood pressures a little bit more closely. But just because the mother had HELLP does not necessarily mean the daughter will have HELLP, but something good to know.
Is it important to, if you do know, what your mother went through when, she was giving birth to you, is that important to convey to your doctor, that sort of medical history?
I think so. I think it adds to things, and I think that there may be some things that we don't necessarily know have a genetic disposition that may pop up. So I have patients sometimes who say, oh, my mom had this, or this happened in the pregnancy. Sometimes it does happen in the pregnancy, sometimes it doesn't. To me, it's just nice to keep in the back of my head. It's something that when you come in for your visit, it's like a checklist checklist, like, this happened to her mom. Let me just make sure nothing's happening here.
Yeah.
So it's just something nice for us to keep in the back of our heads when we see patients.
Yeah,
Absolutely.
and then if something does come up, it kind of helps you connect the dots a little bit there. That's
Absolutely.
really good to know.
It's very good. We always collect the family history whenever on our first visits, of things that may have happened obstetrically, if there's any history of birth defects or cognitive deficiencies. These are all things that we think are important to know at the first visit.
That is key. All right. Let's see here. How effective is the Rogram shot?
Rhogam, yeah. So that was what we're talking about with Rh negative moms.
Oh, okay.
And that's a medication that we give because if you have a lady who is Rh negative, but the baby is Rh positive, in the first pregnancy, nothing happens. But in the second pregnancy, that mom forms antibodies. And so in a second pregnancy, if she has another baby that's Rh positive, the antibodies attack the baby's blood cells and make the baby's blood cells break down. The baby becomes anemic. The Rhogam shot is highly effective. It's one of the things that's really revolutionized Rh disease. And so typically when we have a lady who's Rh negative, which we will check at your first visit when you get all those labs. One of those labs is to see if you're Rh positive or Rh negative. If you're Rh negative, you'll get a shot anytime you have bleeding, which is why it's very important to let your doctor know if you have bleeding. And then we routinely give it to everybody at 28 weeks just to cover them until delivery. At delivery, we'll test the baby's blood type. If the baby's blood type is positive, we'll give it one more time at the end of the pregnancy. If the baby's negative, then the blood types are compatible. We don't have to give it again. So that's definitely super important, but it's very effective in preventing that production of antibodies.
All right. Dr. Ankumah, this was a fantastic chat. I just want to thank our viewers. You had some excellent questions. I so appreciate you watching and weighing in on this. And of course, if you are pregnant or you know someone who is, we would just love for you to share this with them, this Facebook Live. Actually, let's bring in, we have a little prop we want to show you guys before you go. So this will be the final question. We addressed this a little bit in our package at 4:30, but we were talking about when you go to a hospital, and you're about to deliver this baby, and you have all of these resources, because the most interesting thing is I love this, we've had a lot of grandmothers to be who have been asking questions on behalf of their daughter or their daughter-in-law, and even my own mom was like, I had no idea you had all these things in the hospital that you can use, because things have changed. So finally, if you are going to be heading to the delivery room soon in the next 9 months, who knows, what are some of the options they have when they're in labor?
Yeah, so in labor, you can try different positions to kind of help alleviate the stress of labor. One of these, this is a peanut ball actually, and what you can do is when you're lying in the bed, put this between your legs. It kind of helps to open up the pelvis, and so some patients like that. Some patients feel more comfortable in that position. Some patients use birthing balls, so they'll kind of sit on the birthing ball. Again, they like that position. It's like the big exercise ball?
Yeah,
it looks like a big round exercise ball. You just sit on it. Sometimes that kind of helps with position changes, because sometimes those can be uncomfortable during labor, so those position changes are really helpful. Some other things are sometimes during the pushing process, people feel like, I don't feel like I'm making any progress. Yeah. So sometimes we'll bring out mirrors so you can see that the baby's head is actually coming out and you're doing a good job. All right. Or sometimes some people don't want to. That's not helpful for them. That's not helpful for them. That's okay too. It's everybody different things work. Yeah. Sometimes people also are able to use towels or little ropes. So when they're pushing and pulling, it kind of helps with that action. So those are different things that people use.
What are these? Tell me what these are.
These are just little massagers that you can use as well. So this can be used for your foot. This can be on your back. So there are different things that you can use during labor to make yourself more.
You have to give this to your partner. Like, hey, I need, just please rub my back.
Exactly.
Or my feet.
Exactly. So little fun things
Good
that
to
you
know.
can use
We love when we could do props with our Facebook Live. So we appreciate that. Thank you so much. And hey, thank you so much again. Dr. Ankumah answered so many incredible questions. Just a really wide array. Were you surprised?
I was, but they're really excellent questions. It seems that people have really been thinking about things and have really good questions. And I encourage you also make sure to ask your doctor these questions. These are fantastic.
Right. Thank you so much. Yeah. Share this Facebook Live with your loved ones, and hopefully we can get you the information that you need. Thank you so much. We'll see you later.